Hi everyone, it's my pleasure to give you this brief presentation of our abstract entitled Novel Approach Reveals Celiprolol but not Losartan and Bisoprolol as medical therapy of choice for vascular Ehlers-Danlos syndrome. And I would also like to thank all the people involved in the project, as well as the funding agencies without which this clinically highly relevant project would not have been possible. As you got from the title, our abstract concerns with vascular EDS, a rare autosomal dominant disease caused by mutations in the collagen 3 alpha-1 gene. The most devastating clinical sign of VDS is the fragility of oral organs such as the intestines, the uterus, and especially the aorta. To assess the impact of potential medical therapies, we have used a mouse VDS model of which heterozygous mice show a mortality rate of approximately 30% due to aortic rupture. We first recharacterized this mouse model on DNA and mRNA levels, thereby unraveling the true underlying mutation which has a dominant additive effect, explaining the observed phenotype. We further performed transmission electron and multiphoton microscopy for characterization on protein level. For patients, it is important to know will the aorta rupture or not. So will it withstand the forces experienced? Thus, we developed an innovative readout system to measure the aortic rupture force as a readout for the biomechanical integrity of the murine aorta. This allows us to assess the impact of different drugs on the aortic biomechanical integrity. For our measurements, we use a tissue pulley device on which we subsequently mount for each mouse 3 aortic rings respectively. The upper pin can then automatically be pulled upwards until rupture for the aortic ring. Thereby, the force is measured, and this brings me directly to the results. On the y-axis, you can see the relative rupture force in percent. On the x-axis, the 3 different aortic rings, and depicted in green are the wild type, and in red, the heterozygous control animals. In case of VDS, usually antihypertensive drugs are prescribed, and thus the drugs we tested also adhere to this drug class. We have tested the beta blocker Celiprolol due to promising results in VDS patients. Additionally, we have tested Losartan, an ARB, which is frequently prescribed to the phenotypically overlapping Marfan syndrome and hence also prescribed to VDS patients. Furthermore, we have tested a second beta blocker, Bisoprolol. As this slide shows, the treatment of Celiprolol significantly increased the aortic rupture force, explaining the observed added value of Celiprolol in VDS patients, whereas treatment neither with Losartan nor with Bisoprolol had an impact on the aortic rupture force. Thus, we conclude that Celiprolol, but not Losartan and Bisoprolol, should be the medical therapy of choice in VDS. Thank you for your attention, and as well as to the GenTAC committee for giving me the opportunity for this abstract presentation.